I'm TK Brasted, and I'm the Behavioral Health Director at Hope Central. As I've worked in community health and community mental health settings, I've started to recognize that there's a lot of areas of inequity. There's inequities in the quality of services that people receive. Wealthy people receive one level of care, people on Medicaid might receive a different level of care. One of the things that I really love about working at Hope Central is our commitment to providing equitable health care to all people in the Rainier Valley. And that means across socioeconomic lines and also racial and ethnic lines. We want to make sure that all people are receiving the same great care. Children who are from wealthier families and white kids are more likely to receive diagnoses of autism much earlier than people of color or children from low SES families. And part of that has to do with access. But even in studies that I've looked at that have controlled for access, there are differences in how young the kids are when they're diagnosed. We see implicit bias in misdiagnosis. So kids of color are more likely to be misdiagnosed with a conduct disorder than with autism, and that delays the accurate diagnosis, which is so important when it comes to autism care because we want kids to get early intervention. I think Hope Central has been a unique work experience in that we are small enough and nimble enough to really adjust to the felt needs of the community. And there's just a culture that really supports innovation. And so there's been flexibility to reflect and to study and to try to figure out better ways of serving people. And so that has given us the opportunity to learn, but then it also gives us something to teach. Right now I'm leading a county-funded project to provide continuing medical education to providers. The goal of the training is to equip providers to do screening for patients regardless of their cultural background and have that screening be as accurate as if they're doing it with somebody from the dominant culture, from the white culture. Right now, a lot of the screening tools are less sensitive for kids of color, and that's a problem, especially when clinicians are using those for clinical judgment. So the goal then is to equip them with the knowledge about the limitations of those instruments, but also with other strategies to make more accurate determinations about when a kid needs to be referred for further evaluation. Having a daughter of color has made equity issues more personal, and I feel a certain accountability to her to make sure that I do things well in the areas where I have influence and that I'm working toward equity issues in those spheres. It's lit a fire under me. It's created sort of this maybe greater sense of urgency than maybe I would have if it wasn't so personal. I mean, I hope that the work that I'm doing makes at least a small difference for the families that we serve and for the families that are being served by some of the other organizations that we're training. Even if it is a small difference, I hope that we can find ways to do something proactive, like in our spheres of influence, to address inequities.